So again, as you said, very good news. It raises hope that a vaccine solution may be at hand. And in countries that have been successful in controlling the coronavirus, primarily countries in Asia, the need for immediate vaccine is less apparent. But in countries in the West, in Europe, North America, and elsewhere, the need for a vaccine is really clear. And an effective vaccine in addition to continued distancing, masks, and hygiene, are going to be very effective in limiting the spread of COVID-19.
How much faith do you have, Jerome, in the COVAX platform, the World Health Organization platform that will, in theory, help facilitate and really roll out and distribute vaccines on a global scale?
So, something like COVAX is really unprecedented. And we've used that word unprecedented over and over again to describe different aspects of this pandemic. But, now we're looking at potential vaccine solutions. I think not only Pfizer, BioNTech, but, Sinopharm is saying that it may have very hopeful data. The Russian vaccine Gamaleya has also announced that it has a 92% efficacy. We haven't actually seen all the data yet. Other companies are going to announce in the next 1 to 2 months as well. So having something that will now allow that vaccine to be purchased in large quantities and distributed around the world is going to be really key to bringing this pandemic under control. The Gates Foundation has done some modeling that would suggest that if the high-income countries take the first 2 billion doses without any concern for equity, then global COVID deaths will double. And it will also probably make the efficient elimination or reduction of the pandemic much more difficult and may prolong the suffering.
We had recent polls in the U.S. showing that a significant number of Americans are still not on board in terms of getting injected with the vaccine, even should one become available, let's say tomorrow, and at an affordable price, if not free. How do you get around that?
That's going to be a challenge. But we have to address it the way we address all vaccination campaigns. Remember that American parents have their children vaccinated with it. I think it's 26 or 27 different potential injections against 14 different diseases, none of which they've probably seen in their lives. We have a faith in safe and effective vaccines. What's gone on in the last 11 months is there's been a lot of talk about how rapidly we're developing the vaccine, about how we're concerned about safety, but people are wondering, are they really concerned because they seem to be rushing things? So now we have to get out there with the data, with the real data, and show that and assure people that a vaccine that has an efficacy of 90% and no serious side effects that we can see after 2 months of follow-up, that's the key to the FDA emergency use authorization, will be something that people should take. And that will dramatically reduce the number of infections in communities in North America, in the United States. So we have to be persuasive. We have to target communities where resistance to vaccination is already high. This process of community engagement is something that is necessary. And I hope that whatever the political situation 2 months from now, as more and more vaccine becomes available, that we are ready both to distribute the vaccine, to convince people to take the vaccine, and then to actually be able to get it out there and get it into people's arms.